When it comes to healthcare, there's two things that throw a spanner in the works with any sort of treatment, and they are stress and jaw problems. And they've both got one thing in common, which is that they kind of cause havoc on the central nervous system. They disrupt the normal function of the nervous system. So that doesn't mean that if you're stressed or you have a jaw issue that, whatever you're doing, chiropractic, physio, exercise, etc., is not going to work. It means that you need to take these things into account. So the practitioner should be thinking about this and talking to you about it and kind of dealing with that as well. So I just want to briefly go into some of the things you can do to help with stress and to help with jaw problems. Stress. So, a lot of the things that we generally recommend, especially to begin with, are things that people often dismiss because they think they're simple and obvious and they know and etc. But it turns out they're not actually doing them. There's a difference between knowing what's good for you and actually doing it. Like deep abdominal breathing, for example. A lot of people don't know this, but when you take a big deep breath in using your diaphragm, so you allow the air to go down instead of lifting your shoulders, it stimulates something called the vagus nerve, which is a cranial nerve in the brain that goes right down, calming everything down. It reduces your heart rate and your blood pressure, and it chills all the organs out, it calms down your nervous system. And it's the fastest way to activate what we call the parasympathetic nervous system, which is the chill everything out nervous system. So 10 deep breaths, even 5 or 6 deep, slow breaths, like 6 seconds in, 5 seconds out, or something like that, whatever works for you, can really make a difference. Also in the sort of longer term, getting out for a walk, taking yourself out of the situation, going for a walk at lunchtime instead of eating at your desk. Exercise is really good. Physiologically it's great for reducing stress because you get endorphins and stuff like that. But a lot of people find it's also great just for me time, for having time to themselves, which can help to reduce the general stress and improve how you deal with it. Meditation's another one, getting really popular now because there's loads of apps like Headspace and things like that. So definitely recommend you check those out. And in terms of the longer term strategies, this is where you need to be a bit sensitive because there's often things going on in people's lives that we're not equipped to deal with. It's not our jurisdiction to be counsellors, but we are here to listen if you want to talk about anything, any particularly stressful situations that are going on in your life, or difficult people or things you don't know how to deal with. And maybe suggest some options, or at least point you in the right direction of certain professionals that you might help, or certain resources that are available to you. Because sometimes it's, long-term stress is actually what you need to do. Deep breathing and stuff is great, but what you need to do is change the situation, which is easier said than done. But again, there are resources, there are professionals, and there are ways of dealing with things. So if you're really stressed out and you think this might be affecting or hindering your progress, especially if you've got things like aches and pains, headaches, digestive issues, all of these are really affected by stress, then talk to your practitioner about it. You don't have to go into detail necessarily, but just tell them you find that you're generally quite stressed, you wonder whether or not that might be affecting it. What can they suggest? So that's stress. Secondly is jaw problems. Now, if you get a clicking in the jaw, or you notice your jaw kind of deviates to the side a bit, or you've had a history of dental issues, maybe you've been hit in the face, we see kickboxers and things like that get this sort of issue, then you might have a jaw misalignment. They call it TMJ. The TMJ is the name for the jaw, temporomandibular joint. A problem there just upsets your nervous system because the brain's trying to figure out where the skull is, and it's receiving certain information from the jaw that isn't aligned with the eyes and the ears. So that's why it all kind of goes haywire. Now, if that's the case, and again, your chiropractor can assess that by looking and asking you to open your mouth and looking at the deviation of the jaw and feeling for how the joint's moving. If that's the case, then there's different ways of fixing that as well. Some cases you can just do gentle manipulation or mobilisation. I say gentle, I mean it. You shouldn't do anything rough or hard pressure on the jaw. You want to keep it nice and gentle. It's a delicate joint. You can do some gentle mobilisation, give you some exercises you can do at home that involve opening your jaw, keeping it aligned, or maybe pressing slightly from one side to another. Or in some cases we use a little instrument called an activator, and it's just a very delicate instrument that we use to stimulate the nerve endings around here. And in some cases it might mean a trip to the dentist, I'm afraid, but sometimes we send people off to the dentist with a letter saying, we think this person's got a malocclusion of the teeth, it might be affecting the jaw. Could you please have a look at this? Or maybe they've got, a crown that slipped or something like that. Again, could be one of many issues, but you've got to bear all these things in mind when you're trying to get the best outcome for the patient. So I know that's a lot of information in 5 minutes, but I just wanted to give you an overview of the kind of things that we're thinking about and you might want to consider depending on how you're responding to any kind of treatment that you're having. If you've got any questions about that, please let us know, and we hope to see you soon. Take care.